Osteocertus presents OsTi-Lok, the most technologically advanced orthopedic plating system for internal fixation available for small animals in the market today. The system was designed from the ground up with the objective of radically reducing the inventory burden of typical plating kits without compromising the outcome. The system is indicated for a wide range of procedures and patient sizes with the fewest number of implants. This animation will demonstrate the use of OsTi-Lok on metaphyseal fractures. Each internal bone fixation surgery is unique and comes with its own set of characteristics. As you will see, OsTi-Lok's plates are designed to be adaptable and versatile to facilitate a successful surgical outcome. In this example, the fracture is located on the distal femur. Plate selection is made based on patient weight, bone size, and shape. We will select a medium cross plate for this animation. Position the plate over the fracture area and plan for the plate changes necessary to have it closely match the anatomy. We will start by bending the plate on its own plane, sagittal bend, to closely follow over the curved femur of this example. OsTi-Lok comes with a set of sterilizable, easy-to-use instrumentation that will allow the surgeon to configure the plate as needed. Because they are sterilizable, they can be used prior to or during the surgical procedure. To bend the plate sagittally, position the area to be bent in between two benders. Slide the sagittal grip nut handles into the side of the grip nuts and bend the plate as required. Next, we will remove excess plate nodes to end up with a hockey stick configuration. Position the cross node bender on the cross node. Position a straight or angled bender on the node next to the cross node and bend excessively until the bridge breaks. Ensure the severed section points toward the bone. Repeat this process for all the other nodes to be removed. Once all excess nodes are removed, individual nodes might require bending or twisting so that node sits flat on the face of the bone. With the aid of the drill guide, prepare to thread the first screw by drilling a pilot hole into the bone. The drill guide ensures the drill bit will make a pilot hole perpendicular to the plate's node. This is important as it will allow the thread on the head of the screw to engage and lock into the thread of the plate node. To measure the screw length required, the screw gauge is needed. The hook of the screw gauge has a slight bend designed to straighten inside the drilled tunnel. Once the far cortex is reached, the hook springs out, providing tactile feedback to the user. The user can verify reaching on the far cortex by pulling the hook back into the tunnel and sensing the edge of the hole. The hook has an atraumatic design to avoid scraping of the hole. While keeping the hook and scale in position, the screw gauge indicator is slid until it rests on top of the plate. Care must be exercised to maintain the indicator in place relative to the scale when taking a reading. In this reading, an 18 millimeter would protrude 2 millimeters beyond the far cortex. This is important if bicortical fixation is needed. All OsTi-Lok screws are self-tapping, made of titanium alloy, Type 2 anodized, with a T10 style head. In this case, we have selected a 3.5 millimeter locking screw. The OsTi-Lok screwdriver has a tip design that enables pickup of screws directly from the screw tray. Thread the screw into the bone until the head of the screw locks into the plate. The top of the screw will sit flush with the top of the plate. Having partially secured the plate to the distal fragment, the surgeon can decide to test the plate configuration by reducing the fracture with the aid of the benders. If the plate needs additional configuring, the benders can be repositioned for further bending as shown. This in situ bending operation is only recommended for fine-tuning. All major bending should happen before the first screw is placed. Care must be exercised to counteract any in situ bending action to prevent the bone from taking the brunt of the bending loads. Continue placing screws as needed. When placing a screw into a dynamic compression node for radial compression, it is recommended to use a drill guide to keep the drill bit centered in the slot and thus protecting the ledge inside the dynamic compression node. The drill guide also helps protect surrounding soft tissue. After measuring the required screw length with the screw gauge, thread the screw into position. When using the dynamic compression node for axial compression, using a drill guide will reduce the axial compression distance. For maximum axial compression, the pilot needs to be drilled adjacent to the end of the compression node. Exercise caution to avoid damaging the inside of the node. If the inside of the node gets damaged, use a 3.5 millimeter screw. Remove the cross-node bender and complete fixation on the remaining nodes. The reinforced structure of the screw nodes allow for screw nodes to be left empty. A minimum of 3 screws, with at least one being a locking screw on each side of the fracture, is recommended.